So today we're going to dig into a really fascinating medical document. It's a wound care guide that is so clear, so logical, it almost feels more like a checklist for putting together furniture than some complex medical procedure. We're going to break down how this structured protocol can turn what feels like a really daunting task into something totally manageable, empowering patients and cutting down on errors at home. For anyone who's ever had to manage a wound at home, this question is probably all too familiar. Where do you even begin? It can feel like you're lost in a maze of conflicting advice and confusing medical jargon. But what if there was a clear roadmap, a simple, straightforward system to follow? Well, that's exactly what this is. Okay, first things first, and this is absolutely crucial. The information we're about to cover is a specific discharge protocol written by Dr. Gregory Weir for his patients. If you are not one of his patients, you have to, and I mean have to, discuss any wound care with your own doctor. What we're doing here is understanding the logic behind the protocol, not giving out general medical advice. Okay, great. So where does this whole protocol kick off? Well, not with cleaning, not with bandages, but with assessment. See, before you do anything at all, you have to understand what you're looking at. And to do that, the protocol uses two really clever and memorable acronyms, NERDS and STONIES. First up is NERDS. This is your checklist for all the surface-level clues. You start with N for non-healing. Is it just stuck, not getting better? Then E for exudate. Is there any weird fluid coming out? R for red, angry-looking, and fragile tissue. D for any kind of debris. And finally, S for a bad smell. These are the things you can see and smell right on the surface. Next, we've got stonies. And this is where you're looking for signs of deeper trouble. S is for the size of the wound increasing. T for a temperature difference. Does the skin around it feel hotter? O is for osteomyelitis, and this is the big one, a sign the infection could have reached the actual bone. Then you've got N for any new breakdown, E for exudate and edema, which is swelling, and S for smell again. These are the signs that tell you something much more serious might be happening underneath. And this right here just lays it out perfectly. NERDS helps you figure out what's happening on the surface and guides what you should do topically. But if you start seeing signs from the Stonies list, well, that's a huge red flag. It's the wound's way of screaming that there might be a much deeper problem that could require something systemic, like antibiotics. It's a built-in system for figuring out how serious things are. Pretty smart, right? Okay, so we've done our assessment, we know what we're dealing with. Now let's get into the how, the actual steps for cleaning the wound. The process itself is broken down into 6 really logical steps. You start with the basics, right? Wash your hands, put on clean gloves. Then, 2 super important steps to prevent contamination. Pour your cleaning solution into a separate container, and then clean the skin around the wound first. Only then, with a fresh piece of gauze, do you clean the wound itself. And the final step is all about documentation. Take a photo and put a ruler next to it for scale. That separate container step might seem like a tiny little detail, but it is a game changer for infection control. Think about it. If you touch the main bottle with used gauze, you could contaminate your entire supply. This one simple habit makes sure that never happens. And what's the deal with that photo? It is an invaluable, totally objective record. It's not about you guessing, does it look a little better today? No, you can literally track the progress day by day. And putting a ruler next to it gives you an exact scale. This is fantastic for talking to your doctor. It's basically telemedicine in action. All right, the wound has been assessed, it's been cleaned. Now comes the part where we connect that assessment directly to action. It's time to choose the right dressing. The entire decision, this entire fork in the road, comes down to one simple question, which you can now answer because you use that NERDS checklist. Are there signs of infection? And the answer sends you down one of 2 very clear paths. If the answer is yes, there are signs of infection, the protocol tells you to use an Inadine dressing, which has iodine in it to fight bacteria. If the answer is no, the wound looks clean, you use an Adaptic dressing. That's a non-stick dressing designed to just keep the wound moist and protected. Simple as that. No guesswork involved. Now, the protocol also makes room for special cases. For patients with venous ulcers, which are caused by poor blood flow in their legs, there's an extra critical step, applying a special graduated compression bandage. This is so important because it treats the underlying cause, the circulation problem, not just the wound on the skin. And woven through all of this is one clear, consistent message. If you are worried about anything, if something just doesn't look or feel right, do not wait. Call the doctor's office. Being proactive in communicating is a key part of the protocol. So when you step back and look at all this, what can we take away from it? Beyond just wound care, you start to realize this isn't just a list of instructions. It's actually a powerful lesson in structured thinking. The core logic is just beautifully simple. Assess first, then act. Your assessment using nerds and stonies directly and logically tells you what your treatment should be, whether that's Inadine or Adaptic. This creates consistency, and it completely removes the anxiety that comes from uncertainty. And that really just leaves us with a final thought, doesn't it? This simple principle, assess first, then act, is so powerful. I mean, how could applying that same logic to a project at work, or maybe a problem at home, change the outcome? It seems like having a clear process doesn't just heal wounds, it can help prevent mistakes just about everywhere. It's definitely something to think about.